Mesothelioma UK is a national charity which provides information and support to people who are affected by mesothelioma, which is an incurable cancer associated with asbestos exposure. We see around 2,700 cases of mesothelioma in the UK every year, and we have the highest incidence of mesothelioma in the entire world. Mesothelioma UK fund specialist nurses to support those living with mesothelioma. Many mesothelioma UK nurses are trained in respiratory nursing and therefore were often redeployed throughout the pandemic. Mesothelioma patients were considered to be clinically vulnerable and at risk of coming to significant harm if diagnosed with COVID. Mesothelioma UK conducted 2 impact surveys throughout the pandemic. Firstly, securing feedback from patients and their carers, and secondly, obtaining feedback from the nursing team. The patient and carer feedback focused on the disruption caused by the pandemic in terms of accessing hospital appointments, treatment, and clinical trials. The nursing survey captured the views and experiences of nurses working in a specialist or advanced role. It also looked at ways of working and workload, at the quality of care professionals have been able to provide throughout the pandemic, and also at the health and well-being of the nursing team. Throughout the pandemic, all healthcare professionals have had to adapt to different ways of working. The 2 surveys undertaken by Mesothelioma UK have provided very important information. They show us that face-to-face interactions are crucial to building therapeutic relationships and job satisfaction, and should be a key element of patient care. Certain interactions and activities should ideally be undertaken face-to-face due to the sensitivity, such as breaking bad news or discussing prognosis or symptom control. Virtual working should be undertaken with insight into the limitations of the patients that we care for. It's important that we remember the average age of those people affected by mesothelioma and understand that many are unfamiliar with social media or information technology, and therefore will find it a struggle to undertake consultations via video or other virtual platforms. Throughout the pandemic, many healthcare professionals have had to alter the way they work. Our surveys have provided some very insightful feedback which should help us move forward beyond the pandemic. It has become clear that face-to-face interactions are crucial in building therapeutic relationships and job satisfaction, and should be a key element of patient care. Certain interactions and activities should ideally be undertaken face-to-face due to their sensitivity, such as breaking bad news or dealing with difficult issues around symptom control. Virtual working should be undertaken, but we must not forget the average age of those patients who are diagnosed with mesothelioma, many of whom do not have information technology experience and are unfamiliar with social media. Nurses should adopt practices to address the greater support needs of patients and their families, such as the provision of additional support calls to check on well-being. The two surveys that Mesothelioma UK undertook throughout the pandemic have provided excellent feedback. We are now better equipped to understand the needs of our patients, and we have greater tools to meet these needs.